So I'll just say that I'm Mary McCormick. I'm the executive director of the Rotary Club of Milwaukee, and I'm here to welcome you to our third Thursday snack program. And a snack program is different than a lunch program in that it's a little bit simpler. We are expecting that over the next few weeks, we are going to feature members of Rotary who have ideas that are really pertinent to the way we're living today. But it's going to be a little less formal. We will not have a pledge or an invocation. We won't have any club business. You'll just hear me coming in and saying hello. But nonetheless, you can expect really high quality program like we're committed to delivering. And today, we have two terrific Rotarians. We have past President Dan Vliet and a labor and employment attorney with Buelow, Vetter, Olson, Buikema, and Vliet, and Mary Edwards, who's the Vice President of Sales at Coakley Brothers and Coakley Interiors, really talking about some of the important issues that we're all facing as we get ready to go back into the workplace. And I'll mention at this time too that next week, we will have Larry Barton, the CEO of Strang, coming in to give us some more ideas and thoughts about what we should be looking at as we go back into the workplace. So thank you for joining us today, and I'm going to turn this over to past President Dan and Mary Edwards. So thank you for being with us today.
Thank you, Mary. It's great to be back. I'm just sorry I don't get to ring a bell before we start the meeting. So we're asked to address, the issues facing Wisconsin businesses getting back to work and how businesses get back to work in these difficult times. And I think the starting point, I'd have to go back to what Dr. Bob Gleason said at his recent Tuesday presentation. In his view, a much more educated view on the medical end of this than mine, he made the point that this isn't going to be a temporary issue. Don't get overly hopeful about there being a vaccine to solve the problem. He didn't see a quick fix on the horizon, and he emphasized the importance of not underestimating the disease. So I think that gives you a framework for how you want to look at this and consider as you're trying to get your business back up and running, and the issues that we're going to face, not just over the next month or two, but I think you have to be prepared to deal with this for the long haul. Maybe a year, maybe 2 years. We have to, we don't know the length, but I think you have to prepare for the long term. And so the question becomes, how do you do this, and how can your organization survive and hopefully thrive in a different environment? When I was starting to think about what I wanted to talk about today, I started with lists of checklists and the details of what an employer needs to do to address safety and health issues in the workplace. But frankly, I don't think that we have enough time for that, and there are better sources for what you can do to provide a safe workplace. So I did put together a list of those resources that I found helpful, and a copy of that list went out to you with the email for today's presentation. So recommend you take a look there for really the details. Instead, I'd like to talk about the workplace from a more conceptual standpoint and why an employer needs to take this seriously if the business is going to survive and hopefully thrive. Given the news reports I saw last night about the bars opening as a result of the Wisconsin Supreme Court decision striking down Governor Evers' safer at home order, I'm not sure people really appreciate how communicable this disease is. The bars look pretty darn crowded, and people were a heck of a lot closer than 6 feet to everybody in the bar. Also, given the Supreme Court's decision and the partisan politics that we have in Madison and on the federal level, I really wouldn't anticipate getting any clear direction anytime soon from any governmental agency on what's the safest course to take. So I think employers are faced with a situation where they've got to look at the available resources, and then they have to make the decisions that are appropriate for their workplace, what needs to happen there to get things clean and safe for employees and vendors and everybody else. From my perspective, and working with a number of employers in the Milwaukee area, I see that they are working very, very hard to provide safe workplaces. Hand washing stations, plenty of Purell, masks and personal protective equipment are all being used. Cleaning of the surfaces and equipment that employees may touch is becoming part of the daily routine. I don't know if they're on, but I had a chance to talk with Eric Eispister last week, and he tells me that, both Eric and everybody in their plant are working very hard to do all those things, and they've been working overtime to do that. So, it's certainly something that can be done. It just takes more effort on the part of everybody to do that. Many of us have been working from home, and quite a few employees will probably continue to do so. Not going to work may be one of the better ways to reduce risk. While there may be management issues that have to be addressed, if employees are, to make sure that employees are really working effectively from home, it makes sense to let them continue to do so if that's working now. So that's certainly one good alternative. And I think that's one of the things that a lot of employers are finding out now, is that quite a few people are able to work and function pretty darn effectively from home if they have the right resources. And these days, if you have a laptop and a printer, you can get an awful lot of things done from home. I think we've all been finding, at least quite a few of us have been finding that out. Our law firm went to that back middle of March, and we've pretty much kept people out of the office. And we've still been able to work pretty effectively that way. So I think most employers have at least some positions that would fall in that category. So for the employees, though, for a lot of employees, they do need to report to work because there's equipment, there's things that have to be done at work, can't be done from home. And I think it's not enough that the employer provide a safe workplace, but the employees have to they have to believe that they're going into a workplace that is safe for them. Because if they don't feel that way, it'll be an impediment for them wanting to return to work, or they'll come up with excuses for not coming to work, which essentially because they're not sure the employer is doing the job of maintaining a safe workplace. And if you want to have an example of that, just take a look at, let's say, the meat processing industry, and locally take a look at Smithfield in Cudahy, where they had quite a number of infections. That's the situation you want to avoid, because that just creates way too much adverse publicity and creates staffing issues, and you're going to have production issues and all those types of things. So that's sort of the opposite of where you want to be. You want never to get to that situation. So what can employers do if you're starting up now, and if you're taking a look at this, how do I get back in sort of full swing of things? One of the things that OSHA recommends, and there are some great resources on the OSHA website, is that you really start with a risk assessment, and that you can categorize each employee, each position at the level of risk that's involved. And some are going to be high risk because perhaps they work very close with other people, and you're going to have to adjust those separately than people, let's say, that have a location that is separate from other people. They don't come in contact with other people. So they basically have a pyramid of risk, and they suggest that you assess each position where they are, and then what you can do as an employer to minimize the risk for that position. So I think that's a helpful approach, and you'll find a brochure on the OSHA website that sort of lays all that out. Prepare the workplace. I mean, the starting point of things. We talk about obviously worker hygiene. It's the hand washing. It's discouraging handshaking. I have to say, last week I had to actually meet face to face with somebody, which is unusual in itself. And the person reached his hand out, and I shook his hand. It was the first time I'd done that in quite some time. And of course, when I left the meeting, I immediately got my hand sanitizer out. But those kinds of habits that we all have you need to discourage and encourage new habits, whatever they might be, to try to discourage that. I think probably even if we all remember, Dr. Ridley from our club was fist bumping long before that was popular, and I suspect that Dr. Ridley is not even fist bumping now. But I think there are little things you need to think about, like let's say bathroom access. Most bathroom doors, they have handles on the doors, in and out. How are you going to do that? You need to take a look at bathroom access, how everything's going to work in there. You basically want touchless kind of things so that people don't have to, run that risk. You think about, personal protective equipment. We've heard a lot about that, certainly for medical providers. It's essential there. In the workplace, I think it's going to be essential for quite a number of us. So you're looking at, face coverings, face shields, gloves. You need to make an assessment of each position. What sort of protective equipment may be necessary for them? Obviously, cleaning is a big deal. If you're using a cleaning service, you need to, I think, meet with them. You need to make sure that, any surfaces that people are touching are getting cleaned on at least a daily basis, if not more frequently, and that your employees have the ability to clean during the day too. One of the other areas that comes up, because you think about a 6-foot spread between people, but I think we've probably all seen the reports about, I think it was in a restaurant where the ventilation system was what was spreading the COVID-19. And so one of the questions is, what is your ventilation system doing? Is it helping or hurting you? You don't want to have one that is spreading it around your facility. You may need to upgrade your filtration systems, because it's possible to, if you put in proper filtration, I think you can knock out the COVID-19. Don't take my word for it, talk to a professional. But I think that's one way to address that concern, and that's something you might want to think about now. When you have situations with, let's say, shared workplaces and equipment, either stop the sharing or provide time for cleaning between employees for the space or the equipment. Think about your lunchrooms, elevators, bathrooms I mentioned before. Think about them again. But all those areas, you may want to limit the number of people that are going in them. And obviously, any place where there's going to be a number of people in it on a regular basis, the cleaning becomes a more serious issue. I think then the other thing is just who comes back to work. I mentioned, people can work from home. Some people are doing job sharing in situations in particular where there's been maybe a decline in the amount of available work, or, because just basically customers aren't buying quite as much for some businesses. So you can work share, bring fewer people back. You can stagger your shifts. There's a lot of flexibility I think you can get from just spreading people out, both in terms of their office locations, their business locations, and also from a time standpoint, so that there's less overlap. Now, one of the things to think about, and pretty much every business will have high-risk employees, either that they have some risk factor, or like a number of us are over age 60. And the question is, what do you do to accommodate? I would say that most of the guidance that's out there from the White House, from all the federal agencies, recommends making the effort to accommodate those high-risk employees, because you don't want to force somebody to come to work who really doesn't want to be there, and you also don't want to run the risk of any of your employees picking up COVID-19 at work. So what is recommended is that you go through, in those situations with a high-risk employee, that you go through an interactive process with that employee where you spend time trying to see what solution there might be to address the concerns the employee has, any concerns that you might have. And that would be a good way to deal with those employees. One of the things that I've stressed in talking with my clients is that this is a time when you need more tolerance. You just need to take more time and thought and how you might react to a situation a few months ago. We're all in sort of a difficult situation, and we don't know the stressors in other people's lives. And so it's time to take a step back and maybe let a decision wait overnight before you make it on how to deal with an employee. One of the, and I know I've got to wrap up here, but one of the other points and final points I'd like to make is that recognize that employees have some additional leave rights under the Families First Coronavirus Response Act for employers with under 500 employees. They essentially have expanded FMLA leave in situations where the leave is related to coronavirus or the fact that they might have a child who's home from school because the schools are closed down. There are some paid leave provisions that are a part of this that make a significant difference. If an employee comes in and asks for a leave that's coronavirus related, you need to take that into account. You need to update your FMLA leave policies to do that. It's a temporary thing. It's only till the end of the year. But if you aren't familiar with it, you should take that into account. The good news is that it is paid for with an offset. You get a credit on your quarterly Social Security tax obligations. So it's sort of just wrapping up my part of this. I would say that be tolerant. It's a good attribute to have in these difficult times. And in my experience, I see employers getting through this. They're making adjustments. They're doing things that they never did before, but they're doing them and they're being successful. So I think it's entirely possible to do it, but you have to be agile. And I know as Rotary members, you all are, and that you can do it. So with that, I turn it over to Mary.
Thanks, Dan. Time, thought, tolerance, and great tips. Really appreciate that. Which leads really well into our presentation, which is when Peggy back in early March told us that we all would be working from home. She started to formulate, how are we going to bring everybody back into the office? How are we going to do that safely and give everybody peace of mind? So with that, I don't know, Michelle, if you can bring up the presentation, that'd be great. She came up with a program, and she partnered with a company out of the Valley on, next slide, Michelle, please. On, thank you, sorry about that. Maybe it's not working. This presentation, by the way, was included earlier today too. So you're all feel free to go through that and watch the video because it will enhance everything that I'm talking about. Next slide, Michelle, thank you. But one of the things that Peggy came up with is floor markings. What is going to be that circulation pathway as you bring your employees back into work to give them peace of mind? You know, as everybody says, perception is reality. So that starts with, you know, the signage that says anybody that's coming into our facility, please wear a mask. We've got various signs that say wait here, 6 feet apart. You can see there's markers for the elevator as to where to stand. We've got a whole customizable decal kit, if you will. We've got suggestions for what those standards should be. They're both for hard floors and for carpet. They are removable adhesive stickers that last for about 6 months. And they range in price for the standard kit that we're recommending from about $240 for a hard floor surface to about $400 for the carpet. And then plus shipping, handling, and if you want it kitted, we can do that. And we can do this for you not only locally, but as well nationally and globally. Next slide, please, Michelle. So we've got a really easy form that you can fill out. There's 3 other colors. There's a darker blue, there's a gray, there's an orange. All you have to do is just fill this out and we'll get that order placed. The lead time is about 2 to 5 days. Once you have signed the our legend that we would put in front of you. The next slide, please, Michelle. Thank you. And then, you know, going into Coakley Brothers has been synonymous for over, you know, generations for moving excellence, but we've been in the furniture business since 2012. And of course, as you can imagine, we represent over 200 manufacturers, and they have come up with everything imaginable to bring those collaborative and open workspaces back to being safe. So with that, there's everything from clear glass dividers that are a ½ inch thick that can be just clamped on and screwed. Those come in frosted as well, or a low iron glass. The next one is the M series table screen. This has the ability to be attached via a magnet, and there's various sizes, both from the height and the width. Next slide, Michelle, please. And then we've got writable divider boards. And then as well, if you want to have a customizable, promotable, let's say branding on your desktops, you can do that as well. Next slide, please, Michelle. Thank you. And then we go as far as providing wraparounds for height adjustable desks. These can be, again, they can be in acrylic, they can be frosted, they can be clear, they can be in what's called a PET fabric. So it runs the gamut on what we can do for those benching systems and for tables that you have spread throughout your facility that you need to provide distance 6 feet or more for your employees to feel safe. We've got mobile dividers, one called the split mobile screen. What that allows is to have the ambient light still come through, and you can move these anywhere throughout your facility. Next slide, please, Michelle. And then, of course, Dan mentioned earlier, we've got a variety of hand sanitizer systems that not only include the sanitizer, but tissues, gloves, masks. You can see on the right there, there's mobile, or actually I should say permanent screens that you can move around, but they go from floor to ceiling that can help you divide various spaces, whether it's a conference room or it's a lounge area. Next slide, please, Michelle. And then for regular standard 29-inch high desktops, we've got the wraps for those that we can apply to those tabletops. And then for those of your millennials that want to go and continue to focus and be private, we've got a variety of acoustical cab pods that they can go and find a good place to work. Next slide, please. We've got everything from, quick room dividers. You can see this Ilto is a great way to divide space and really give you a more sense of, I guess, if you've got open spaces and you want to enclose those spaces, it's an inexpensive way to do so. Yes, the old phone booth is back. Those have been around for a good number of years, but they are applicable in this COVID time. Next slide, please. And then we've got sneeze guards. So to protect your receptionists, we've got these in plexiglass. Again, we've got slotted and non-slotted sneeze guards, different sizes, different heights to maintain that social distancing. We also have, again, more mobile panels, if you will, featuring acoustical properties that allow you to keep the noise level down and create separation between your users. And then just a few more slides here. The twist and turn for panels, that's available. Again, another example of a simple way to provide a good looking architectural way to separate and enclose your spaces. Next slide, please. And then this is one of our go-to chair vendors. They're out of Las Vegas, Nevada. This is Genie. This is copper mesh. And for those of you who know that copper disinfects itself within a matter of hours. So we've got comfortable, smart, good-looking, and relatively inexpensive task chairs and as well guest chairs that we can provide. Just another example of a place to go and have some privacy in in a small space there. Next slide, please, Michelle. We've got some mobile, lightweight dividers, as you can see from the Walls brand. And then the last is the Haya brand, which means small room. It's one of our other go-to manufacturers by OFS that provides, again, acoustical properties, a nice light, a table to work on, and to be productive within the office. And I think that is about it. So feel free, if there's anybody out there who has offices around the country, we're part of what's called the Office Moving Alliance. And that allows us to partner with like-minded reputable companies throughout the country and globally that can handle any offices that you might have. And if you need furniture or if you need decals, please let us know. I will say that if you're unsure as to how should you put this in your office, we've been working with companies and we've been asking them to provide what's called a CAD plan. And that will tell us, that will allow our designers to actually map out what your circulation route should be within your office pretty easily. So thanks.
Thank you, Mary. Glad to have you here with Dan. That was really very informative. And if, I have one question that's coming through in the chat function for Dan, but for those of you who are still listening, please send along any other questions that you have. We have a few minutes here. Dan, any advice about potential lawsuits from customers or employees who believe they were infected in your organization?
Okay, let's divide that in two. When you're thinking about your employees, recognize that if there's a claim that an employee became infected with COVID-19 in the workplace or somehow connected with the job, that's really a workers' comp claim. And so that's what your workers' comp coverage is for. With regard to somebody else being, on your premises, that's also what you have insurance for. So those are, that's the first place you go with either of those. Now, the other end of that is that this is one of the reasons why it's important to read and make every effort to comply with, let's say, the recommendations from OSHA or the CDC, so that you can point to that and say, this is what we did in our workplace to minimize the exposure. And so the odds of the person, picking this up in the workplace are slim. And that can be a question of, are you, let's say, and I didn't get into it, but, doing the temperature checks and all those types of things so that you have an assessment of whether or not potentially anybody in your workplace actually may have symptoms. So there's a variety of things you can do, but I think it's documenting your efforts to comply and then making every effort to comply and recognizing that you do have insurance coverage in both instances.
Thank you, Dan. Another question here. Does the family leave expansion require that the employee either have the virus or is caring for a family member with the virus? And then I'll just follow up. If the employer is required to be on site for their job, if the employee is required to be on site for their job and they are in a high-risk category and we cannot accommodate, what resources should we turn to?
Okay, there's actually, when you take a look at this, there's a number of different categories that they're entitled to leave. And it's essentially whether or not the employee has been diagnosed with COVID-19, whether or not the employee has been required to self-quarantine due to concerns related to COVID-19, whether or not the employee is caring for a family member under either of those two situations related to COVID-19. The employee has symptoms of COVID-19 and needs to seek a medical diagnosis. Finally, whether or not necessary to care for a child. So there's specific categories where the employee would be entitled to paid leave or the expanded FMLA leave.
Are there any government subsidies to help pay for this special equipment or for special leave practices?
For the leave, yes, because there is an offset that is actually not going to be a cost to the employer, because that you get a credit for any of the special paid leave that the employer provides. You get a credit on your quarterly Social Security tax payment. So that's taken care of. In terms of additional equipment that may be necessary, not to my knowledge. That's going to be a cost of doing business in these times.
Thank you. Another question coming in from Jeff Martinka. Is there any liability consideration if we offer a COVID bonus or hazard pay to employees working with the public? Any thoughts on how long such bonuses might be paid if in fact we offer them?
I think that can be you have a couple of questions there. One is, if you're offering a bonus to some of your employees, but not all of your employees, make sure everybody that's bearing additional risk is getting a bonus, because otherwise you'll have some disgruntled employees. And then the second issue is, okay, so how long are you going to do the bonus? You know, if I don't know that the risk is going to be that much different, maybe you're able to mitigate the risk, and so that you can bring it down from right now. If it's a significant risk, it's worth paying a bonus, and that in a month or two you're able to bring it down through, you know, personal protection, whatever else you've done in the workplace. But I think some employers have had issues with that, where they've done some sort of bonus or additional hourly payment, and then they stop it, and the employees are saying, yeah, but the risk is the same. What's the difference? So I think you need, if you're going to have a cutoff, you've got to tie it to some good reasons, would be my suggestion.
That's thoughtful. And I think that wraps up our questions, which is really a good time for us to wrap up. So I want to thank both Dan and Mary for being with us here today. I think that it was really valuable information. And a couple of things. One is that I understand some people had trouble linking into the beginning of the program. There might have been a problem with the link, but the program is recorded and will be available on our YouTube channel, and there will be a link to it in the email that is in your inbox early tomorrow morning. We will also have Dan's list of resources that he provided and Mary's PowerPoint and video. And then come back next Thursday at noon to hear the CEO of Strang Incorporated really provide some more guidance on what's useful to be thinking about when you're bringing your employees back to work and getting your workplace up and going again. So thank you to you again. Thank you to all the people who tuned in today. Please invite others to join us for Thursday snack or Tuesday lunch. And feel free to share the recording once it's available. So thank you, everybody.
Thank you.
Thank you.